Welcome to Counterpoint. I'm Tanya Granick-Allen. Since COVID-19 appeared on the scene, there has been a lot of information and advice relayed by politicians, health authorities, doctors, and so-called experts as to what the best course of societal action and medical treatment ought to be. The past year and a half has been incredibly confusing, and I am increasingly frustrated by all of this contradictory advice. I strongly believe that every family must make the best healthcare and lifestyle choices for themselves. And as such, like perhaps many of you, I've decided to research for myself and to make the best possible decision. And that is a good thing. People should inform themselves about medical treatments and health measures. Therefore, I was disturbed to see the College of Physicians and Surgeons of Ontario, the CPSO, issue a statement threatening its members, the doctors, to only toe the public health line or face disciplinary action, which could include having their medical license suspended or even cancelled. Well, is this necessary? Should the CPSO's so-called Statement on Public Health Misinformation be taken seriously, considering the science seems not to be settled? Why should the Public Health Authority be the final arbiter of opinions? Isn't public debate always a good thing, especially when it comes to things so serious such as healthcare choices? Well, joining me later to discuss the legal implications of such a policy statement is lawyer Phil Horgan. But now we're going to be hearing from Dr. Matthew Strauss, a critical care ICU physician and member of the CPSO. Dr. Strauss, thank you so much for joining me today. I'm happy to delve into this topic because, again, I was somewhat shocked to see the statement come out. I saw it on Twitter. I was combing through my Twitter feed, and boom, there's the statement. What do you think compelled, or what was the impetus for the CPSO to issue such a statement?
Oh, I can only speculate. I mean, I think that the college does have a role in regulating members who are going out on a limb, saying things that are not scientifically backed, let's say. So if as a physician I was to go out and say that, kale smoothies cure brain cancer, that sort of thing, I think they would have a role in reeling that back. Or if I was proposing treatments that aren't proven or even proven to be false to treat COVID-19 or anything else, particularly given that folks are so anxious and panicked about it right now.
Right.
What was really troubling about this statement was it didn't point out any particular misinformation. Rather, it pointed out viewpoints that they did not like. Most troubling to me, as somebody who's been skeptical about the public health benefits of some of the lockdown overreach, let's say, was that it just said, and anti-lockdown speech is obviously misinformation and must be stopped. So that was very peculiar and very distressing.
So this is good that you've kind of explained. So there have always been some kind of limitations, shall we say, on what a physician can and cannot say, or more so what they cannot say, not so much what they can say, right?
I think both. I think if something's proven to work and you say that it doesn't, or if you fail to recommend it to your patients, that would be a problem. But the problem is when they start banning whole schools of thought, let's say, or contentious issues where there's no solid science, let's say. And I think I'm in a pretty good position to say when science is solidified and when it hasn't.
And you mentioned, for example, their initial statement, because there was a clarification, well, some kind of attempt to clarify their initial statement. Am I correct? Issued a few weeks after this initial one?
Yeah, which I didn't find completely clarifying. So they said, no, we just meant blatant misinformation to do with anti-vaccines or anti-masks. And this time they left anti-lockdown off the list. I think because anti-lockdown has become very mainstream. Like, you have the Canadian Pediatric Society tweeting just this morning about how lockdowns need to end because children's mental health is suffering.
Right.
So unless they were going to take the entire Canadian Pediatric Society to task and those of the members who are in Ontario, the CPS, to take away their license, I think they quickly got a lot of blowback and found out that the limb they had gone out on was not strong.
Okay, but that's interesting.
As pertaining to lockdowns.
Because public health does still, to this day, like the science table or whomever is making these decisions, at least in Ontario, for example, does state, we should be staying at home, we should be locking down. But here, the CPSO, against their own statement, is suggesting that, okay, now we're going to exclude the anti-lockdown misinformation, if you will. But that is part of the public health message. So to me, this seems utterly confusing for a physician as to what one can and cannot talk about.
Yeah, I mean, I would like to extend as much compassion as possible to the people who crafted these statements. I think the folks who go and work for the college, what they're used to disciplining is folks who are prescribing opioids unnecessarily to folks who they know are drug dealers or to people who abuse patients.
Sorry, Dr.
So
Strauss, sorry, I've got to cut to commercial. I lost track of the time, but we'll be right back right after this message.
Sure thing.
Welcome back. We're discussing the new statement by the CPSO, the College of Physicians and Surgeons of Ontario, the governing body for doctors here in Ontario. And joining me is Dr. Matthew Strauss, critical care ICU physician here in Ontario. Just before the commercial break, you were actually sort of, trying to put yourself in the mindset of those who would have drafted the statement in their defense. So please carry on.
Oh yeah, I want to be as compassionate as possible. Like I was saying, they're used to disciplining folks who are prescribing opioids unnecessarily, or to drug dealers, or physicians who are abusing patients, and these sorts of terrible things. Mm-hmm. I think that they've had a lot of blowback of people lodging complaints against outspoken physicians, some of whom may have rather fringe beliefs. So I think this is their first foray into trying to moderate the public discussion among physicians, and I guess I forgive them for having done not a great job at it, perhaps having bitten off more than it can chew. I'm glad they attempted to clarify, even though the clarification wasn't as clarifying as it should have been. So, it wasn't a great response from them, but I guess I understand how it came about.
Yeah, no, I can appreciate that. But, again, one of the most, the things that stood out most to me from this statement is basically that any misinformation would deemed any advice or opinion that runs contrary to the public health authority. That's alarming to me because, again, I'm listing some examples here. I've heard the public health authority say, don't wear a mask. I remember at one point, early days of the pandemic, I was even almost mocked in a hospital for wearing a mask early days. Now you can't even step foot in a hospital without not only wearing a mask, but throwing out your old one and putting on a new one. So don't wear a mask, wear a mask. Don't shut the border, shut the border. Viruses live on surfaces, viruses don't live on surfaces. Viruses spread outdoors, now they don't spread outdoors. Or do they not? Do they only live outside? So basically my point is, if the health authority can't even get the signs straight, why would a physician want to toe the line? And how does one even navigate those waters?
Yeah, going back to the confusion point, I can do you one better. I am aware of a resident physician who was disciplined by the hospital for wanting to wear a mask in early days. So, I mean, there's so much egg on so many faces to go around.
Wow.
And so I guess when I say I was completely alarmed by the statement, even as I'm trying to be compassionate to them, I don't think that makes it any less alarming or any more acceptable. But what I see it as part of is the entire cancel culture, loss of enlightenment values.
Right.
Like, we don't know what we don't know, and we're not going to figure things out unless we have well-meaning, intelligent, educated people kind of sort it out in the public square. So I feel like the CPSO got ramrodded into this anti-enlightenment position, an illiberal position where they weren't letting folks discuss things anymore. And I think that's tragic, but it's part of a broader social trend. Okay,
so just one little tiny side point. So would such a statement carry more weight in a country, in your opinion, obviously, with because we have socialized medicine here, or would this not even be a consideration in a two-tier or private healthcare system? Or do you think it doesn't matter?
I mean, what I know is that nothing like this happened in the United States. I think there is a feeling that we all work for the same healthcare system, so the same healthcare system has to have a party line, and we all have to toe it. So I think
Right.
there is something communist adjacent to this statement and to the fact that it happened in this country.
Okay, just curious about that. Okay, now earlier, you gave an interesting example, like that there might be disciplinary actions faced if, say, a physician, as you suggested, say drink kale smoothies to cure brain cancer or whatnot. But ultimately, I do believe that medicine needs to be patient-centric. So if a patient came to you with questions or treatment suggestions, I mean, I think a patient ought to be able to have that open dialogue with their physician. I mean, that's, again, even as the statement said, that's a very important trust role that a patient has with their physician. And my concern is that this kind of imposes a chilling effect on those kinds of discussions. I have brought research to not in COVID, but previous to COVID, on certain topics, and I want to have that kind of dialogue because I want ultimately the best healthcare for myself. So why can't I have that discussion?
I think you absolutely can. I think that this policy is about social media posts, which is still very alarming. But I don't think this statement has much to do with the discussion that you have with your doctor. Which I agree with you, needs to be absolutely sacrosanct. Like provided you're, again, this is what makes it so complicated, is if you are a complete hack who is recommending magic treatments rather than scientific treatments to patients, then like that does come under the college's auspices ultimately.
Right. I mean, ultimately, they're the ones who issue the license. So if there is a lodged complaint, and there are several complaints, it doesn't matter. Every complaint must be taken seriously. So I can appreciate that. And I agree, things have been very, very sensitive and sensationalized almost to some degree in the time of COVID. People are there's a lot of confusion. And, I hopefully soon we'll get out of this mess. But listen, Dr. Strauss, thank you so much for joining, and keep up the great work on the front lines.
Oh, my pleasure. Thank you.
Thank you. Well, we've heard from a doctor now on the matter of the CPSO. Well, now we're going to also hear from a lawyer, Phil Horgan, who's a director with the Law Professionals of Ontario. So I guess the first things first is, does the CPSO, the College of Physicians and Surgeons of Ontario, have the authority to censor physicians like this, to compel them to abide by public health orders, especially in general, COVID aside?
Well, the CPSO is the regulator for physicians in the province of Ontario. They have a code of conduct. They have professional standards. In the same way you talked to me about being a director in the law professions, I'm a bencher of the Law Society. And with a different hat, I engage in discipline cases of lawyers or paralegals when they fall offside. So the power that the CPSO wields is not inconsiderate. It can have a huge impact on a physician, absolutely. And so when they brought forward the statement on April 30, which included warnings about speaking out about anti-masking, anti-distancing, or anti-lockdown measures, that seemed to go over the line of what a public interest would require, or, for example, in this case, a government actor would be allowed to go. And in particular, think about it in the scientific method. There's a need for debate. There's a need for dissenting viewpoints. That's how we arrive at a fuller understanding of matters, especially having to do with medicine.
Yeah, no, I agree with you. I think, well, for me, it seemed that this statement would have a chilling effect on open patient-physician dialogue. Okay, granted, I know this statement seemed to be more targeted towards online social media posts. However, for me, I feel like this kind of statement could be extrapolated to infringe upon a patient's right to proper care. And I say that very carefully, because patients have a right to that kind of care, and they have a right to have expressions with their physician, and have that dialogue and have that debate among doctors themselves. Yes, but I'm not a doctor. I'm a laywoman, and if I, as a patient, want to see a doctor and I want to say, I've heard about this research. Is this ridiculous? What is your opinion on it? I want to know that my doctor will be able to exercise his freedom of expression, express his opinion on it. If I value his and trust him, why not?
I think your point about public trust in the profession or in the individual physician is part of the public interest that goes to being a physician, to help people with their individual circumstances understand implications, what impact a vaccination may have with me if I've got immunity issues or other matters. So you're right. This is a matter for which it seems to me it's a bit of an overreach. I'll take it a further step. I golf. According to the data, there were 27 million rounds of golf played in Ontario in 2020 before vaccinations, without much of any evidence of outdoor activities causing contagion or infection. I dare say there are a number of doctors who golf. And in the circumstances, we've come to a situation when they say you're not allowed to speak about anti-lockdown measures. I'm speaking out about the impositions on golfing. Why couldn't a doctor speak to that? Or alternatively, if you have a boat, you can clean your boat, you can fix your boat, but apparently you can't take it out on the water because of the fact that there's some risk. Well, again, these are matters for which all the documents and evidence that I've seen suggest that outdoor activities are far safer without much incident of infection But yet in the province of Ontario, anyway, they've been locked down. And in a sense, why should doctors be limited to speaking out on those matters?
Well, then that's a fair point. I think, and we have seen dozens and dozens, if not hundreds of doctors speak out definitely against the lockdown, some with concerns about masking, some pro-masking, some concerns with masking, some pro-vaccine, some vaccine concern. Why not let that dialogue happen? I think, again, every individual has to make their own healthcare choices. Doctors, their obligations to their patient. Yes, I appreciate that there's a governing body. They have to be held accountable to them, if there are massive infractions and infringements and errors. But ultimately, that's between me and a doctor. And I certainly, I don't think there's a right to a physician in healthcare in Canada. However, sometimes I wonder, am I on the right track here? I want to be able to have that discussion with my doctor, and I don't want them to be disciplined for it. In the 20 seconds before we have to go to commercial, am I outlandish here? Is this crazy?
No, and if you're talking about the individual relationship, draw it back a little from the 30,000-foot level. Think of comparisons to countries like Taiwan or South Korea. I mean, Taiwan, from my understanding, has had 11 deaths. Now, it's an island country, but they took a far different approach on issues of rapid testing,
right,
about contact tracing and so on than we did in Canada.
Okay, Phil, we've got to cut to commercial, but we're going to pick this up right when we return. Welcome back. We're wrapping up our discussion on the College of Physicians and Surgeons of Ontario's recent statement that seemed to have a chilling effect on what doctors can and cannot express publicly. Basically, you can't really express anything contrary to public authority or public health measures. So, Phil, just before commercial break, you were showing different jurisdictions. We talked about Taiwan. Taiwan, actually, they've had 12 deaths. I think there was a recent one, so not 11, but 12 total.
Well, thanks for the correction, but still, the argument would be, especially when they seem to be cracking down on social media posts, why wouldn't international comparisons be fair game for public discussion?
It's true.
And in that context, why shouldn't we get the best evidence from other jurisdictions? Or think about it in the context of the last 15 months, Tanya. We've had varying positions taken by CDC or the WHO or by our own authorities in this country, whether it be on masks, whether it be on social gatherings, whether it be on other matters. It's not been a consistent message from the authorities through that entire period. I think we are entitled to look to our doctors to help us, especially when it comes to our own personal integrity.
I agree. Now, some might say, though, well, if we have doctors going out on their own, say extra officio, outside of their office, to express an opinion that might run contrary to what the public health authorities, that will cause actually greater confusion. And, here's a doctor going on social media, going on their Facebook or their Twitter account, putting something out there. How are we going to get a message through? I mean, is there a defense of that?
Absolutely. That's how we muddle through on all sorts of issues in the public sphere. And the reality is the notion that there only should be the regulator commenting or cracking down on dissentient views, I quite frankly find more chilling, more dangerous. I'm reminded of Václav Havel's story about the greengrocer, that the greengrocer was obliged to put up signs because it was obliged to maintain a view, even though the person's integrity didn't believe it, but wished to avoid confrontation with the state. Well, we do it differently here. And those ideas, those propositions allow for further discussion, perhaps further experimentation and or other contemplations. And quite frankly, we've been pretty good at sorting out the truth from the non-truth in the fullness of time. And so the concerns being raised by the CPSO seem to me to be of a theme. I was involved in the case in which the CPSO's mandates for against doctors who had moral objections to things like medical assistance in dying were being told that they would nevertheless have to provide an effective referral to a patient who may request that, even though it went straight to the core of their soul or integrity to avoid that. And although those cases were not successful in trying to find some exemption for that, there were plenty of instances that the college used to say, well, you can do it all sorts of different ways without us having to change our rules.
Oh, wow.
So they can be quite adamant and quite powerful in how they wish to present how they view the provision of these services should be allowed.
So this is, if I can say, maybe not the first time then, you've pointed out a very good example with medical assistance in dying, or euthanasia, as some of us refer to it as, where there's been where physicians were compelled to, I guess you could say, violate their conscience, or that they could not do something, that they were compelled to do something else instead. That seems very heavy-handed.
Well, we argued to that extent, and in fact, 2 levels of court found that there were breaches of sections 2A of the Charter, those having to do with religion, in this case, of the Christian and Catholic doctors who brought the case. They actually didn't even touch on the issue of conscience, which also applied because they have found a breach of the Charter. But they further then said that those provisions were saved by the provisions of Section 1 of what was demonstrably justified in a free and democratic society.
Right.
So the reality is these are important issues. They can affect not merely the individual doctor, but in fact how that patient gets information. And I think we should be very fearful of appreciate there's we don't want to have doctors running wild with bad science or bad opinions. When it comes to this kind of thing, I think we're still muddling through what the best methodology should be.
Right.
And I don't think we should be closing off the debate, especially at the medical professional level.
Phil, always a pleasure. Thank you so much for joining me.
Thank you for having me.
Well, we all have had enough of COVID and the lockdowns, and we want to see the end of this. But does listening to only one voice or one opinion help us get there, help us achieve that end? For Counterpoint, I'm Tanya Granick-Allen.